What's up? Let's get to the elephant in the room in terms of baseball's return. Yes, we have somewhat of an agreement between the players and the owners. We have a schedule in the works. We have rosters in the works. What about the pandemic? What about coronavirus? If you missed it, my last video, I went through sort of all the new rules and kind of the baseball-y kind of update of what's happening in 2020. I'll put a card to that video if you want to check that out. And, honestly, if you want to avoid this conversation, I don't blame you. If you kind of need a break from talking about this stuff, by all means, and you want to keep it to baseball, that's where you want to go to that video. I'll also put a link in the description if you missed that. But really, there is no avoiding that this situation is going to play a huge role in how the season goes or doesn't go, really. So certainly a topic that I felt worth discussing. Specifically on testing, I just felt like Hardball Talk here, Craig Calcaterra really broke it down in a nice, easy way to consume here. So I'm going to basically run through that real quick, and also there'll be a link to this article in the description. Essentially, any baseball staff, it's considered covered individuals in the language is how they put it, will submit a symptoms exposure questionnaire before even arriving at spring training, which is set to start on Wednesday. They're also going to have a temperature check, a COVID-19 saliva or nose swab test, and a blood test for antibodies before arriving at spring training. After reporting, everyone will have their temperature and symptoms checked, at least twice per day. Anyone with a temp in excess of 100.4 degrees will not be allowed to enter a ballpark. If symptoms develop at the park, they must isolate as soon as possible. Teams must conduct tracing to identify who that person interacted with and clean/disinfect all facilities. Players, coaches, trainers, and others who have close physical contact with players will have saliva tests every other day. All other staff will have multiple tests per week. Players who test positive will be placed on a special COVID-19 injured list. In order to be activated from that COVID-19 list, players need to test negative twice in at least 24 hours apart. They cannot have had a fever within the last 72 hours. They have to have taken an antibody test and have a doctor sign off from a joint COVID-19 committee created by the league and the union before they can return. So quite a few hoops that need to be jumped through. Not sure what the timetables of getting all those things done, but very interesting. And another note, MLB's testing will be handled by baseball's anti-doping lab in Utah. That's all kind of adding a wrinkle into anything as well. But again, just kind of wanted to relay the nuts and bolts of how that's all going to work. Sounds pretty comprehensive. Sounds like there's going to be a lot of trying to get in front of things and identify players who have COVID-19 as soon as possible so they can act as quick as possible. But what are people thinking on this season? Is it going to work? Is it not going to work? How many games are they going to play? Very interesting. Seth Stowe's ran a poll, as you see here, had over 1,000 votes on it. As you can see here, pretty split. 38.9% of voters believed that we'd get through the entire 60 games and postseason. And 36.9 said 30 games or fewer are going to be played before basically everything gets shut down. And then about a quarter of the voters were somewhere in between there. As you can see here, I actually voted for 30 games or less. Let's talk about that. Given the situation, I don't exactly think it's a good idea for baseball to return, to be honest. And that has less to do about sort of MLB, players, whatever else, than it does to what's going on in the United States. Obviously, there's a team in Canada as well. But it's very strange to me that everything was suspended in spring training when it was, and now they're trying to get the season back rolling when everything is much, much worse than it was. I guess on the flip side, it feels like we have some more data. We know some more about the virus than we did then. But it is worse, much worse circumstances that baseball's returning to than when it left spring training. So that's a big thing to me. But just trying to make this work with all the teams based in their home stadiums, in their home states, seems like such a logistical nightmare. It's going to be such a challenge to travel that much and to, you're dealing with all these state governments that are shutting things down and reopening things all the time. And it sounds like they're going to provide baseball some exemptions in certain states, primarily based off of the testing and safety protocols that baseball is putting out there. Basically, they're trying to make it clear that they're going to be as safe as possible. But at some point, if everybody's going to know the testing numbers out there, once a guy's not on the field, and not in a dugout or whatever, people are going to know how many guys are tested and not tested and positive. I think, what's going to happen. Basically, whether or not the season goes on as planned depends how much tolerance there's going to be for mass spread. It seems at least one team is likely going to have an outbreak where multiple players are tested positive all at the same time. Let's say one team has 15 guys that are all positive at the same time. Is the host city of that team going to feel comfortable still hosting games? Is the cities that that team would travel to comfortable with that team traveling to their city? Are opposing teams going to be comfortable traveling, playing against those teams? Obviously, the guys who would be active would be players who haven't tested positive yet, but clearly those players would have been exposed to guys that did. So it's all going to come down to a tolerance thing. And, it's really difficult to speculate. I suppose, my definition of what's, probably going to work, it might be different than Rob Manfred. So that's where we get, maybe there's a situation where I'd be more likely to shut things down and it wouldn't go more than 30 games. Whereas, whoever's going to be in control of this thing, Rob Manfred, Tony Clark, the owners, the players, maybe there's a little bit more tolerance involved there and it does go on. Hard to say. Now, you may have heard that statement and made the assumption that, I'm just more risk averse than, maybe I should be. It's not really that dangerous as I'm making it out to be. The positive news is that the survival rate of people who get COVID-19 in the United States is really high, a lot higher than some other countries that are not so fortunate. A lot of you, I'm sure, know there's baseball going on in other parts of the world right now. They're playing in South Korea. They're playing in Japan. They're playing in Taiwan. But the situation is so dramatically different in those areas. It is crazy. I have up here the World Health Organization's COVID-19 situation report. This is from June 28th. And we'll scroll down here one moment. And as you can see on that day, the total confirmed new cases in the United States was up over 44,000. Total new deaths was 650 on this date. Let's find a couple of those other countries here one moment. And on that same day, in Japan, total new confirmed cases just 93, 0 deaths. Republic of Korea, South Korea is what we usually refer to it as here. Total confirmed new cases 62, 0. So 44,000 versus less than 100. I mean, it's comparing apples to oranges. You really can't say, hey, they're returning to baseball. Hey, they're going to have fans there soon. Why can't we do that? Different ball game. Can't compare the two. Totally different. And you'd have to think that professional athletes, these guys were in much better than average shape than the average American. They have access to excellent health care. They're being tested all the time. So yeah, there's some things that are lined up there where that are positives, and also these guys are going to be better protected than the average American. Sure, yeah, I can definitely agree with that. I'm not going to pretend like that's not the case. But it's always going to be true that, everyone would rather not get it, period. So there's that. And then we still don't really know much about the long-term impact. I'm not any kind of expert. I'm not trying to pretend I am, but it does seem like this can vary from person to person quite a bit. Some people test positive and never even have any symptoms. Some people die from this. Young people die from this sometimes. So, and then of course, there are at-risk individuals who are playing, and there are also at-risk individuals who are going to be engaged in the game's return. But I was happy to see Lavelli Neal's report in the Star Tribune that the Twins coaches who are more experienced will put it, Bob McClure and Bill Evans, who are both over 65, will not be at the ballpark this year. So I think that's a relief to see as a Twins fan. So hopefully everything goes well. I'm certainly rooting for, everything to go well and for the season to go on in the postseason and everybody to stay healthy. I there's just so many challenges that baseball's never had to navigate before. But anyway, this has been Tom Froming. Thanks for checking this out. We'll talk again soon.